Okay, thank you everyone for joining us for this last minute, not COVID related media availability. With the incoming weather, we're having Dr. Ryan Parker, who's the St. Francis Health System Medical Director for Emergency Services, give an update on what we've seen historically in inclement weather and storms like this, kind of and what to do in those situations when someone may be injured. So I'll turn it over to Dr. Parker.
Thanks. Well, we know that with ice and snow and wintry weather that there are going to be accidents. And so just kind of putting out some information about sort of what to look for, what kind of care should you be seeking, whether urgent care or emergent care, and how to define that. And also just some tips on maybe things to avoid to protect yourself. We know that most falls or accidents happen within about 10 feet of a patient's front door. So taking those precautions and trying just to stay in and not get out is really helpful. Partially, if history repeats itself, and we're hoping that it doesn't, last year at this time when we had our last winter storm in February of 2021, our average patient per day in the wintertime is 180-ish, 180 to 190 patients a day. We saw 250 patients on February 11th, and about 140 of those were weather related, falls, slips, car accidents because of the ice. And 41 of those were serious enough to need admission. And the injuries ranged from, broken arms, broken hips, broken wrist, all the way to bleeds in the brain and skull fractures from falling. So we wanted to put some caution out there for our patients, especially if you're in an older age group and are on blood thinners or cardiovascular medicines that make you a little more apt to fall. Please be especially cautious. But I will say last year we had injuries that range from ages in the 20s all the way to the 90s. So it can definitely affect anybody. The other thing to be aware of is that not just the orthopedic injuries, but a lot of times we get out in the winter trying to ice our or salt our driveways and, shovel some snow, and we're not in the best cardiovascular health. And so putting that strain on our hearts, there is often a little spike in heart attacks in situations like this too. So my plea is it's okay to just bundle up, stay inside, put on a good movie, get some hot cocoa or some coffee, and stay in for a couple of days.
Thank you, Dr. Parker. We'll open it up for questions.
I have a question. Tanya with Fox 23. What are some of the calls coming in already? I know it's pretty preliminary right now. None of the good stuff comes until later this afternoon, but anything yet?
I have not personally seen anything yet. I think, one of the things to remember is that we're still working through this Omicron wave. And so our EDs and our hospitals, our inpatient status is still very, very full. And that's kind of the other piece to consider, that, our capacity is at its peak. And so as of right now in the emergency department, it's still mostly just those types of typical emergency complaints and our Omicron surge.
So a follow-up. So do you have any concerns going into tonight and tomorrow then with the emergency rooms being full and, this icy weather and car crashes?
Well, that's one of the reasons that we wanted to talk to, our community, is that if we could, we would like to preempt that. We are always happy to take care of anybody who presents to our front door. But, just like last year, if we could have avoided those injuries, we are here no matter what, 24/7. But for those patients, it's horribly inconvenient to break your hip or break your arm, and awful. And in those cases where, it was even a worse injury with the head bleed and stuff, could be life-threatening. So I think people have this frantic need to get out of the house when they're told not to get on the roads. And I think, we know the weather's probably going to get better by the weekend. It's just going to be a couple of days of staying in. So if at all possible, that's what would be helpful.
And so to alleviate some of maybe the stresses in the emergency room, what are some factors of, okay, they need to go to the emergency room versus immediate care to kind of alleviate some of that stress?
Absolutely. So we have a wonderful urgent care system in St. Francis. And so those types of injuries where, you fall on your wrist, you have aches and pains, you slip, things like that. Those are perfect scenarios to check into our urgent cares. Obviously, if you have a fall, or especially for our more elderly patients, or for instance, if you're on blood thinners and you have an injury, those types of patients should come to the emergency department and not the urgent care. Obviously, if you slip and fall and have disorientation or altered mental status or pass out or those types of scenarios. Also, the typical things, if you're having chest pain or difficulty breathing or dizziness, things like that, that would be an emergent complaint and not the urgent care.
And Dr. Parker, what about if it's not weather related and something that someone's considering their urgent care for, but they don't want to leave their house? Do you want to talk about the virtual?
Oh, absolutely. We have virtual urgent care that's open 24/7. So, and that's a good option that if you're not quite sure, that is available for you to make a phone call. And then we have one of our local PAs or physicians that will answer that call for you, and they can help you kind of triage where you need to be.
Any other questions? You're welcome to put them in the comments or ask them. Okay, well, if there are no questions, thank you all for covering this, and thank you, Dr. Parker, for sharing the information.
Thanks, Lauren. Appreciate everybody. Have a good day.